Hey, future nurses, and welcome back. Today, we are tackling a skill that is an absolute cornerstone of nursing practice, starting a peripheral IV. So let's dive right in.
Okay, let's be real for a second. Does the thought of doing this for the first time make your palms just a little bit sweaty? If so, you are definitely not alone. It can feel really intimidating at first, but I promise you, with the right approach and a little practice, this is a skill you can and you absolutely will master. So we're going to break this whole thing down using a framework you already live and breathe, the nursing process. This way, you're not just memorizing steps. You're going to master the how and, more importantly, the critical why behind every single action. And hey, if this is the kind of learning that helps you, do us a favor and hit that subscribe button for more nursing explainers. So, what are we really talking about here? Officially, it's the process of giving a prescribed IV solution. But the real keywords, the ones that should be flashing in your mind, are correctly and safely. This is way more than just poking a needle in. It's about careful verification, using a strict sterile technique, and constantly watching to make sure everything is going smoothly. Now, before you even think about unwrapping a single piece of equipment, the most important work begins. That's the assessment and planning phase. This is where you use your brain and your clinical judgment to set yourself and your patient up for success.
Your very first stop is the client's chart. You're basically a detective here. You're looking for any red flags. Do they have a latex allergy? What about a history of a mastectomy or maybe an AV fistula that tells you to avoid a certain arm? This chart review is your #1 safety net.
This number 2. This needs to be burned into your brain. You must always use 2 unique identifiers, usually name and date of birth, to make sure you have the right patient. This is a hard stop. It's a non-negotiable rule that prevents so many potential errors.
Next up, the prescription itself. You are going to triple check it against the medication administration record, or the MAR, and you're looking for 3 key things. Is this the right solution? Is it set to run at the right rate? And is it for the right total volume? Getting any of these wrong can be a big deal, so this check is crucial.
You know, a smooth IV start is all about the setup. It's like being a chef. You need your mise en place. So gather everything: the bag of fluid, the tubing, an IV pole, the pump, your antiseptic, gloves, labels, the whole shebang before you even walk into the room. It keeps you focused and helps keep your patient calm. All right, our prep work is done. All our ducks are in a row. Now it's time for the main event, the hands-on procedure. Let's walk through it step by step. Okay, first, let's get our tubing ready. Open the package using aseptic technique. That means keeping everything super clean, and immediately close that little roller clamp. Next, you'll spike the IV bag, hang it on the pole, and give the drip chamber a little squeeze until it's about half full. Now for the most important part, priming the line. You're going to slowly open the clamp and let the fluid run all the way through, pushing out every single air bubble. This is a huge safety step to prevent something called an air embolism. And I want to pause on this for a second because it's so important. Aseptic technique is completely non-negotiable. Every connection point, every time you touch something, is a potential doorway for germs. Keeping things sterile is one of the most fundamental ways you protect your patient from infection. Okay, it's time to connect. After you've washed your hands and put on gloves, talk your patient through what you're doing. A little explanation goes a long way in calming their nerves. Then, you're going to scrub the hub. Clean that little connector really well with an alcohol wipe, and, this is key, let it air dry completely. Don't fan it, don't blow on it, just let it dry. Then, flush the site with some saline while watching it closely for any puffiness or pain. If it all looks good, connect your primed tubing, open the roller clamp, and start the pump. So, the pump is running, the fluid is dripping, you're done, right? Nope, not even close. Your job is far from over. Now you're in the evaluation phase, which means you are constantly monitoring, assessing, and ready to troubleshoot if something goes wrong.
This is what you're looking for. A healthy IV site is pretty boring. No swelling, normal skin color, no pain. It's dry. But a common complication is infiltration.
That's when the fluid leaks out of the vein and into the tissue around it. You'll see swelling, maybe some redness or paleness. It might feel cool to the touch, and it will be painful for your patient.
So, what do you do when something goes wrong? What's your first move when that pump starts beeping at you or you walk in and the site just looks puffy?
Here's your game plan. If the flow stops, try the simplest thing first. Just help the patient reposition their arm. The catheter might just be bent at the joint. But if you suspect infiltration or see a hematoma, a bruise, you need to act fast. Number 1, stop the infusion immediately. Number 2, take out the catheter. And number 3, prepare to start a new IV, ideally in the other arm or at least much higher up on the same arm.
And remember, not every patient is the same. For kids, we usually try to avoid their hands if possible, since they use them so much and it's easier to dislodge. And for our older adults, their skin and veins can be incredibly fragile. You have to be gentle. No aggressive rubbing or too much pressure, because that can easily cause skin tears or bruising.
Okay, we are in the home stretch. We've assessed, we've planned, we've implemented. Now for the final and absolutely essential step, documentation. Remember the golden rule. If you didn't chart it, it didn't happen.
So what goes in your note? You need to be thorough. Document the location, which arm, which vein. What's the solution and what's the rate? Describe the condition of the IV site. How did the client tolerate the procedure? Did you provide any education? And of course, record the amount infused on the I&O record. This paints a crystal clear picture for the next nurse.
So, if you take one thing away from this whole explainer, let it be this. Anyone can learn to follow steps, but what makes you a great nurse, a safe nurse, is truly understanding the why behind every single action you take. Master the rationales, not just the routine.
You know, having a really solid grasp of skills like this is absolutely key for crushing the NCLEX. To help you with your studies, we've dropped some links in the description below to some of our favorite NCLEX review books. They can be a huge help, so definitely go check them out.
So what should we break down next? What's a clinical skill you want to see explained just like this one? Let us know in the comments below. And if you found this helpful, please hit that like button, share it with your study group, and subscribe for more nursing school content. Thanks for watching.